Oh. Go ahead. Give me a second.
Having some technical difficulties. Waiting on Dr. Kaylee.
There we go.
There she
Now
is.
we're live. I'm trying to figure out how to be live on two phones at the same time.
We're pretty cool.
We've got them like lined up and like staggered, and it's really, you can only see my shirt in the back of it now. I need to back up. There we go. Just do it. What's up, physio memes?
What? It's Twin Tuesday. Happy Twin Tuesday, guys. Yay. Super excited at Atlas Chiropractic Center. And I'm with Dr. Kaylee today. So we're just going to talk about some really cool things with Twin Tuesday. Since Dr. Johanna's out, we are bringing other people in the community to you that you can add to your healthcare team, depending on what's going on with you. So eventually we're going to get into what Dr. Kaylee is known for and what she does and what she's so great at. If you don't know, because if you've talked to me, you probably already know what she does, especially if you're a woman.
Yep, absolutely. It's so exciting. Vaginas and vertebrae, by the way, is like the best name for this.
Yeah.
So we've got a lot of cool things we're going to talk about today in line with that title as well. And yeah, I don't know. What do you want me to talk about?
Cool. Well, let's start with what you do. How do you help? So I'll send patients her way all the time.
Yeah. So I'm a pelvic floor physical therapist, and what I do is I specialize in treating, and I like to like break it down in a way of I treat things that have to deal with poop, pee, or sex, or anything in between with pregnancy, postpartum, all the things that if you don't have, your life is a little bit more miserable, right? So it's really important to understand that incontinence or leakage of urine or diastasis recti, prolapse, constipation, frequent diarrhea, pain with having a bowel movement, or just not really understanding what's going on with your body down there. You're trying to have sex, you can't have comfortable sex, all of those things, or you're an active athlete and having problems. Those are the things that I treat. So I kind of like to say that I treat the missing link, because most of us in healthcare, we kind of skip the vagina because nobody wants to talk about it or see it, let alone. So,
so that's Kaylee does.
Yep, there we go. So I'm there, and that's what I work on, and I do that for anyone who is looking to have kids, doesn't want to have kids, pretty much pregnant or postpartum. And so, yeah.
And everyone, and like she said, because we focus a lot on pregnancy and postpartum in the office, and that is a very, very good time to consult with a pelvic floor PT. But you don't have to not have issues just because you haven't been pregnant or postpartum. I've seen Dr. Kaylee. I'm a CrossFitter. Do jump ropes.
Yep, and the reason that I do what I do, I haven't had children yet either, but I had stress urinary incontinence. I leaked with running and jumping, and it was just really annoying and embarrassing, and also had pain with sex. So got married and had to go through that kind of traumatic experience of not really understanding that mental aspect of it and why I felt less of a woman, because I wasn't able to do what I thought a woman was supposed to do. And so it's also just important to do that. Or people come to me for preventative measures all the time. Like, hey, I want to start doing Olympic weightlifting, but I know that the pelvic floor is important, but I don't know what to expect or what I need to pay attention to or how I need to kind of move forward with that. So, yeah.
And I would say, too, because I've coached in the community in St. Pete as well, and I'm sure it's in other communities as well. I think there's a disconnect. There's a disconnect if you're not a woman, so you don't have the same as another woman, and you're coaching and you're not really sure what that looks like when it comes to bracing and lifting properly, or if there are any of those dysfunction issues that we've talked about, how to actually handle them and what are signs and symptoms. And then sometimes, guys, I know you might not be comfortable expressing that to your coaches or other people, but know there are people out there who are here to help. We do have the education, and we want to make you feel comfortable so you can get help and to fix those problems.
Yeah, and you deserve the help, and understanding that you deserve that is a huge step and a huge win in and of itself, and that's really what I run my practice around. It's called Fem Empowerment and Advocacy. Empowerment and advocacy. So I'm giving you choices and education, advocating for you to understand you deserve that. So again, regardless of what transition in life you're in, I'm a huge believer that it takes a village to treat a woman and a man. I just specialize in women. But to treat you, you really need to have the chiropractic care. You really need to have the physical therapist. You really need to have the mental health counseling. You need to have the nutrition. You need to have the dietetics. You've got to be really well-rounded and understand everything that's going into the process of being here. So it's really important that we learn that. And I think that it's cool that we can provide that together. May or may not have become kind of friends. I kind of like her.
We might hang out sometimes.
Off
of Facebook Lives.
With Prosecco.
Some cool things that I just want to mention, because I know we talked about some common signs of pelvic floor or core dysfunction. Some other things with a lot of pregnant moms that come into my practice that I hear a lot is that they are scared of ripping during labor, which I think is a completely fair thing to be scared of. And I would think most of their providers aren't really telling them that there are things that they can do for that area. So I recently learned that you know things you can do to prep that area, so you can decrease that likeliness of tearing.
Yeah, it's really important to understand, one, your body going into it. But typically what I do in my practice is at 35 weeks or between 35 and 40 weeks, I actually ask you and your partner to come in. And I ask you to come in because I want to educate you both, because hopefully you're not doing this alone, or your doula can come with you, or your midwife, whoever you want there with that appointment. Because what I do is I'm going to teach you something called perineal massage. And that is, I wish I brought my vagina model.
Dang it!
Oh, so let's say this is your vagina. Your perineum is that muscle that's right between the vagina and the rectum. So it's like that thick band. If I can't show you obviously physically, but it's a thick band there where the vagina hole is, rectum hole is, and then you've got the band there, and that's called your perineum. And so perineal massage, one of the things that I like to educate people on is it's not only about doing this on the inside. You've got to be able to do this all around that perineum. And I always recommend that clients and their spouse or their partner, you learn how to do this from that point from a professional, because when you read about it on a blog, you're like, wait, where am I supposed to go?
Well, it's just going to be
what
awkward.
am I going to do?
You're going to be out of your comfort zone.
And nobody tells you how long.
How long should I
do it? How much pressure? What if it hurts? Like, how do I do all of those things? So that's something that I recommend. So with that, you're going to start that after 35 weeks because, hopefully it won't, but it can promote labor if you get too relaxed. So you got to be careful. So that's why we wait until that point. And you use a lubricant. You put your finger right on the outside where the perineal muscle is. And if I can remember later, we'll post a picture up with kind of like that diagram of what I'm talking about. Because right now I'm like, it's not on my face. This is the vagina, right? So being able to rub and add a good amount of pressure, and you're not only adding pressure, you're also pulling the tendon and the muscle apart by separating your fingers in different ways. And it's just a really important part to be able to progress into that labor and delivery process, because if we can teach that tissue to relax, you're going to have less likelihood of tearing or ripping. So we've got to kind of work on that. And then we also work on deep breathing and learning how, or what that concept is of breathe the baby out, which is so important. So being able to take that deep breath in and being able to relax that same area I was just talking about, or relax your pelvic floor or your vagina, being able to relax to allow the baby to come out is actually the natural way to do it, instead of bearing down and Valsalva and push, because we want to make sure that it's happening naturally if possible. And then also going over all the positions that you can to prevent the tearing. Again, more likely, research is showing, and also based on experience and expertise, it's more likely if you're on your back to have a little bit of tearing. But again, it doesn't mean that it has to be that way. You can do things to prevent that from occurring. A little less likely if you're in a squat or hands and knees and things like that. So yeah, there's a lot that goes into that perineal massage and a lot that goes into preparing yourself to prevent the tearing. It's also just, lubricant, what types of things that I can use to prevent that from happening. I'm going to scoot this over.
And I just want you guys to know more than anything is that you have resources, and whether you're in St. Pete or not, Kaylee does consults on the phone, and things as well, because there's just so much misinformation out there. And of course we can easily Google stuff, but it gets very overwhelming. It's not the best information on where to go with things. And a lot of times, at least with the moms I'm seeing in my office, they're not being encouraged or empowered by their providers. They're being scared and told them that there is nothing that they can do, that they are going to rip. Like all these things that just, honestly, I haven't heard one that is like 100% true or that you can promise anyone. So just giving you guys more education so you know what questions to ask, so you feel comfortable in the decisions that you're making, and that you know that you have choices.
And there's a lot of different choices out there. If it's not video consultation, I can help you find someone. There are people that can help you kind of figure those things out. But yeah, it's super important to just understand all of the areas of it, understand that you can prevent a lot of it to an extent, and just
nothing's ever promised.
And what to do if something occurs.
So Dr. Kaylee, why did we name our live vaginas and vertebrae?
Because we both have vaginas and vertebrae. No. Actually, we're super excited about this. So you can tell we're kind of goofy together, and we have a lot of the same passion. And one of the things that drew me to this practice where Dr. Johanna and Dr. Madeline are is the fact that they have the same passion that I have. And it's also one that PTs and chiropractors can work together. And we can actually be a really amazing team if we do it right? So they treat me, I treat them. It's been a really wonderful, beautiful relationship. And we have decided that we're going to start a podcast together. Yeah. So we're super pumped about it. It's going to be called Vaginas and Vertebrae, based on one. That's what I do, treat vaginas. She treats more than the vertebrae, but we just came with something to negotiate.
It's going to be catchy.
So we're really excited to be bringing that to you. We're going to be talking about a lot of these issues. And for me, for instance, I love to hear questions from clients, or I love to hear questions from people that I don't know. Yeah. And I love to answer those on a live or on a video, or be able to send them this beautiful long email about, this is what that means. This is why you're doing that. This is why you feel that way. Because like Madeline said, Dr. Madeline, like she said, when you type in something, for instance, I did this the other day based on what a client told me. She had blood with her stool when she was having a bowel movement. So I just typed it in because I try to put my brain as much as I can where my clients are, because I think sometimes in healthcare, I know the information, but I forget what it feels like not to, which is why it's so important for me to educate you. And I typed in blood and stool, and it told me I had all these terrible things and I was going to die. And so I was just like, okay, so let me slow down. So I've been jotting down the things that my clients are asking questions about. And for me, it's a lot about perineal tear. Mm-hmm. How do you do proper perineal massage? What about sex positions if you're having pain with sex? Can I change that? What about diastasis recti? How soon is too soon to go back to the gym after giving birth?
That's a big one.
How long can I work out during pregnancy? What if I feel a ball or an egg or something sitting on my rectum down there?
What if your crotch feels like it's on fire?
Yeah, what if your crotch feels like it's on fire? What if I'm peeing on myself? What if I'm pooping on myself?
All are great questions.
All are amazing questions and things that we need to answer. And so we've decided, and I know she has a whole slew as well. And I know that, like, the cool part is we're just going to integrate that within the community, and we're going to be asking for you all to give us information and to let us know what you want us to answer. Because we want it to be, hey, go watch episode 4 where we answer that question. Mm-hmm. Or, hey, I talked to this gynecologist on that episode, so please go listen to her and what she does. And be able to offer that as a resource for not only St. Pete, but I think it's going to go a lot bigger than that.
I think it is too.
Because I think, it's so important, and we're so passionate about it, and that's obvious. But, I think,
we know it is, because now we put it out in the universe.
Yep,
that's bigger than St. Pete.
Now it has to happen as we're scribbling down my wonderfully drawn logo.
It's going to be beautiful, but you can't see it yet because her scribble is great.
Yeah, so we wanted to announce that and just say that we are so excited to be able to do that, because, again, we've kind of crossed paths in a way that we didn't know that it would ever turn into something where we could educate the same amount of people. And I'm just so excited to see that and be able to integrate chiropractic care into my practice and send patients her way as well. So it's been really fun to do that. I'm excited. I love podcasts and I love listening to myself talk. So it's going to be great. It'll be good.
All choked up, Kaylee.
I always choke people up, with my corny jokes. I know.
She'll be here all day.
Yes. She's like, no, I'm going to kick her out. Oh, it'll be good though. But yeah, I'm super excited about that. And also, it's going to be just a good platform. I think we've decided to have it as a YouTube channel, or a channel as far as video goes as well. I'm a lot more fun on video. I don't do as well behind a microphone where nobody sees me, because I'm performing arts background. I'm very expressive. So I think that we're excited about that, and there will be a lot of cool things coming. So I can't wait.
I'm definitely very excited about it too, because as we've just talked a little bit, I am so excited. I want to educate the community about what you guys can do, especially as we just relate to women better, which is okay, and how you can take charge of your health and feel empowered in your life, so you're not stuck anymore. And I just see it too much, and I've been there, so I get it. I totally get it, and I think we're always on a journey, and we're always healing a little bit more. So we just want to help you as much as possible on that, for wherever you are.
And you're not alone on that journey either. And I think too, one of the things I'm trying to do within my practice is incorporate that trauma-based healing as well. Because my story, many of you that you follow me, if you don't, you need to be following me. I have, a history of just trauma and things that have occurred that have contributed to pelvic floor dysfunction, and realizing the mental acuity that I need to have and the strength that you have to have in order to understand that you can and deserve to recover, or that you can and deserve to get back to your choice of sport, or being able to get back to that health that you look for. You have to first start here, and it's a holistic, whole body approach. So you'll never hear me say, I'm the only one for you. You'll never hear her say that she's the only one for you. We have to work together to get you the best care, and I think that going at it alone is never the best approach because then we won't stay accountable. So if you have two of us on your back, you have no choice.
Be solid.
Yep.
Awesome.
Yeah, that's it for me.
Another thing, we have anything else for you guys today? Happy Twin Tuesday. Thanks for tuning in. We really appreciate it. We are very excited. Stay tuned and we'll make sure we get all the information out. So if you're interested, you can follow us and check out our new podcast.
Yay!
It'll be on YouTube.
So she's about to kick me out with my Just Do It shirt.
No, she can stay.
Okay.
I think patients will love your shirt.
We'll see. See what's in that Yeti back there. No, I'm just kidding. All right, we will see you later.